78 new messages? They know. They all know.
What's your assessment?
Well, I think...
Not you, Blake.
Ultrasound showed fluid in Morrison's pouch. We should get an abdominal CT.
And what are we looking for in the CT?
We need to rule out bleeding from the liver or the spleen. We should also evaluate the retroperitoneal space. If there's active bleeding on the CT, we set him up for an X-lap.
Are you forgetting anything?
We cleared his C-spine. We sent blood out for a trauma panel, a tox screen, alcohol levels.
And?
Order a tithe and cross match.
Oh, of course, obviously. I skipped that.
Okay, well, let's not skip steps. We're a level 1 trauma center. I need to know what Dillard taught you. Let's fill him with fluids and prep him for a CT. Tell me what you see.
Retroperitoneal fluid.
Around what? Be specific. The right kidney. It's a grade 4 injury with an active extravasation. We are going to need to do an X-lap.
Should I call upstairs? What do we have? A patient came in with a head lac, GCS of 14, loss of consciousness at the scene.
Can you clear the head CT so we can take him up for an X-lap?
There's no shift, contusion, or bleed. It's a mild concussion. I'll do a quick exam, but he's cleared for surgery.
Is this the pastor who gave his congregation a special blessing?
Word travels fast.
All around the hospital.
I bet the pews will be full on Sunday.
Monitor for any neurodeficits. I will do another check post-op.
Blake, get him ready for transport.
Edwards, show her where it is.
What's the trickiest part of a partial nephrectomy?
I think it's essential.
Not you, Blake.
Mobilizing the colon quickly to get adequate exposure of the kidney.
By your 3rd year, you should know this surgery inside and out.
I do.
Okay, so you are going to walk me through this. Your hands are my hands, and my hands do not like making mistakes. Are you ready?
I am, yes, I'm ready.
With what? Because I have nothing in my hands.
Right, 10 blade.
10 blade.
Massage serratus fascia. Now identifying the breed devitalized tissue.
Go on.
Cauterize cortical bleeders and establish hemostasis before closure. Now close using a running absorbable suture to avoid post-op fistulas. You can even reinforce using an absorbable mesh.
Oh, that's thinking ahead. I like that. Dr. Gray, Dr. Blake, I thought I'd stop in to see how the first day was going.
Thank you, sir. It's been...
Blake has been dictating my surgical steps.
Great. How's she doing?
Not too well. If I'd done what she just suggested, the patient would have major renal cortex bleeding. What did you miss?
What?
What did I do that you missed?
Debris, hemostasis, close.
Come on, figure it out.
I was watching you, I didn't see.
DeLuca, can you fill in the blanks?
Dr. Blake didn't tell you to clamp the hilum.
Dr. Gray, the hilum is clamped.
It is, sir, because I clamped it on my own. I didn't skip a step, and therefore the patient did not hemorrhage and die. Blake, hand your suction to DeLuca.
Dr. Gray, I know this procedure.
You would have killed the patient, Blake. If your hands had been my hands on this patient, he'd be dead. It's that simple. Step away from the table.